Welcome back to Sleep Medicine and Physical Therapy. Today we'll talk about Part 5, Physiotherapeutic Resources to Improve Sleep, on the topic of sleep ergonomics. Again, I'm Chris, physiotherapy student. It is during sleep that the whole body recomposes and prepares itself for the next day. Being asleep is a state of physical and mental restoration, essential to the body, where the plasticity of the entire organism occurs. Thus, body supporting during sleep is of major importance. The human spine must be supported by a combination of a mattress, a bed base, and a pillow to adopt its natural position. The acquisition of a non-neutral position may influence painful processes, in particular the musculoskeletal system pathologies. Sleep quality and comfort are frequent questions of patients in the daily practice of physiotherapists, as the number of hours and quality of sleep is well established to affect overall health. And to acquire that, one must sleep on a proper surface. The posture adopted during sleep influences the physical health of the individual and may be correlated with musculoskeletal disorders in the shoulders, neck, lumbar region, as well as headaches, which predispose to sleep fragmentation, poor quality and quantity, leading to sleep disturbances. A proper sleep system, that is, mattress and support structure and head pillow, can align the spine to some extent in its neutral posture, which is the same as the spine alignment in the upright position. A non-neutral posture can affect lateral bending and unbalanced loading on the intervertebral disc, as well as the facet joints. For the intervertebral discs, growth and restoration depend on the amount of pressure and its manner of application on them as to hydrate the soft tissues. During sleep, there is a change of the direction of the gravity vector. The intervertebral discs are unloaded and can rehydrate to restore their elasticity. Supplying a patient or client with proper surfaces upon which to relax is also the focus of physical therapy. The causes of pain in the axial skeletal muscle system may be due to mechanical disorder, postural and ergonomic factors, or excessive overload of the upper or lower limbs. Mechanical factors can be attributed to resting postures such as deviations in the position of the head, static or repetitive contractions of the neck muscle. For instance, sleeping in an incorrect height of the pillow, high, low, or too low, or even no pillow, or even sleeping in an incorrect posture can lead to frequent awakenings, to pain during the night and following day, or even to chronic pain in the course of time. How is the correct body alignment during sleep? Having a good posture can increase body awareness and injury prevention. Posture can be defined as the distribution of body masses in space, this distribution being harmonious, involving a minimum amount of effort and overload, and leading to what we call good posture. The alignment of body mass and joints is one of the fundamental characteristics to acquire the good posture. However, maintaining alignment does not depend on our voluntary control. The movement is often carried out involuntarily during the recumbent position that we adopt when asleep, and also via reflexes. There are several factors that influence and configure posture during sleep. Proper maintenance of postures, body parts with the center line of gravity, is associated with lower energy expenditure due to the lower demand for anti-gravity muscles. The muscular effort spent on maintaining the different postures adopted is based on the position of the different body parts of the body, according to their relative weight, that is, the head 6 to 8%, trunk 40 to 46%, upper limbs 11 to 14%, and lower limbs 33 to 40% of the total body weight. According to the assumed posture, there is a change in the internal pressure of the intervertebral discs. Changes in body posture are one of the problems often faced by young people, adults, and older ones. In this context, the prophylactic approach of a postural re-education with an intervention in the posture aims to minimize the effects of the degenerative processes and the mechanical overload caused by the continued bad posture in all day and also in night periods. The posture is called bad or poor when it is ineffective, when it does not reach the intended purpose, or when a greater muscular force is used to maintain it, consuming more energy than it should. A poor posture can result in pain due to mechanical overload for a long period of time, adaptive shortening of soft tissues, and consequent muscle weakness. Mechanical stresses, such as those imposed by postures outside the anatomical alignment for a prolonged period, lead to an increase in production of fibroblasts and collagen, with a loss of the need for tissues such as muscles and soft tissues. When the posture is maintained statically for a long period of time, with isometric and repetitive contractions, the phases of muscle relaxation become noticeably short, promoting muscle fatigue that can translate into a sensation of discomfort or pain. In the biomechanics of spine, aspects such as length, strength, endurance, and muscle coordination are involved, maintaining the balance between them. The lack of application of healthy biomechanics to the spine during sleep is associated with a decrease in range of motion, change in alignment, and normal control in the kinesthetic perception due to inadequate postural habits maintained for a prolonged period of time. Among the lengths associated with postural dysfunctions, the decrease in range of motion due to changes in flexibility, pain, and increased muscle tension due to overload stands out. In addition, there's a decrease in strength and resistance, leading to muscle fatigue due to the postures adopted or due to disuse and inadequate trunk stabilization. The increase in static, repetitive, and excessive resistance increases the risk of inflammatory or degenerative processes that affect the skeletal muscle system. Postural assessment at bedtime makes it possible to assess imbalances to restructure posture through ideal support for the entire skeletal muscle system. The pelvic area of the human body is broader and heavier than other body parts. The thoracic area, because of the presence of the lungs, is wider but not heavier. When lying in a lateral decompetence for sleep on a very firm mattress, there is unsuitable spinal support, as only the broader areas of the body are supported. For example, pelvis and shoulder. When these forces are not respected, ischemia may appear in body regions that are in contact with the surface. Ischemia generates metabolic substances which will stimulate the nerve extremities and lead to discomfort and pain in the lumbar and neck regions. The continuity of this factor can cause chronic musculoskeletal pain in the neck spine. Postural discomfort due to continuous muscle contraction can decrease blood supply, increase tension, or ligament compression, leading to the individual change its posture. Different studies have shown the association of microtrauma with pain and functional disability caused by poor posture during sleep, highlighting the importance to have ideal support for the body and a correct and aligned posture. The adopted posture for sleeping is something incredibly unique and particular. We move more than 10 times during sleep. This tends to decrease with age, and most of the time we are unable to remember the position in which we fall asleep or wake up. The body requires a position according to the degree of comfort and habit, so the body tends to adapt during a change in the MSK system. In comparison about mattress, custom-made surface. Firm and soft mattresses show that the custom-made mattress have maintained the natural alignment of the spine, arranged with different stiffness zones. In the firm mattress, the spine has bent down in the lumbar area, as only the shoulder and pelvis received good support on these surfaces. This is because of the shoulder and pelvis being broader. In the soft mattress, the pelvis sags more into the mattress, while the position of the vertebra, C7, on soft surfaces is higher than that of the pelvis. That is because of the pelvic area it being broader and heavier than other body parts. Therefore, custom-made mattress allow the neutral alignment of the spine close to the natural standing position. The most common sleeping position in adults is the lateral decompetence, most likely due to the increased support of the spinal structures, followed by the supine and prone positions, despite the last one, the prone position, not being indicated for sleep. The supine and lateral decompetence are the sleeping postures most indicated, as they allow greater comfort and efficiency, yet both postures require the use of two pillows, one supporting the head and the other below or between the knees. The supine position allows the alignment of the spine with the use of pillows, cushions, and supports. For this case, it is recommended to use a pillow for the head and another pillow under the knees to align the pelvis. When sleeping in the prone position, the head is usually turned to the side, which increases the rotation of the neck. This rotation is up to 90 degrees and flexion of 10 to 20 degrees of the neck, with negative repercussions on muscular structures, nerves, vessels, ligaments, and other segments. This posture constitutes a potential source of neck pain, fatigue, muscle tension, headache, and pain in the TMJ. Consequently, there is an increase in spinal load because several facet joints of the most cranial vertebra are compressed on the ipsilateral side, while the contralateral ligaments will be under tension and stretching. Blood vessels can also be compressed, causing headaches, dizziness, and other disorders. Despite all of these disadvantages, many people prefer the prone. It is therefore advisable to improve the alignment of the spine by placing a pillow under the shoulder and ribcage which the head is facing, or by raising the arm from that side, or even placing a pillow under the belly to restore lumbar lordosis. The same alignment of an eventual hyperlordosis can be achieved by raising the knee and the hip next to which the head is rotated, or by placing a pillow under the hip and knee on this side. In fact, most of the aforementioned corrections implement a slight change of position to an almost lateral position. Inadequate posture of the head when sleeping imposes a considerable consumption of muscle energy in the neck region. Poor neck posture during sleep increase biomechanical stresses on the neck spine structures, reducing neck pain and stiffness, headache, and scapular or arm pain, resulting in low-quality sleep. A suitable pillow is a proper support for neck lordosis. Choosing an adequate pillow can reduce pain and improve sleep quality. The big question is, how is the suitable pillow? How do I choose one? Where do we have it on the market? There's still no consensus regarding the best type of material for pillows, or their shapes and heights, which are still under debate in the literature. The main role of a pillow during sleep is to support the neck spine in a neutral position. A neutral position of the spine prevents loss of neck spine curvature and neck waking symptoms by minimizing end-range positioning of spinal segments. In addition, proper support can increase the contact area between the neck and pillow, so the pressure exerted upon the muscles can be evenly distributed. Modifications of the neck inclination from 10 to 15 degrees alter muscle activity and blood supply in the region. During the neck flexion, the horizontal distance between the center of gravity of the head and the axis joints and the AO joint increases considerably. The contraction of the scapular elevator muscles with repercussions on the branchial plexus is expressed by symptoms of pain, tingling, and decreased strength in the upper limbs. Likewise, such manifestations can be observed when lying down, maintaining the prolonged positioning of the neck in semiflexion. Neck and spine pain as a whole has been described as one of the factors that can interfere with sleep quality. Pain and discomfort were related to higher and longer EMG activities of trapezius in participants who have neck and shoulder pain. However, the relation of comfort and EMG activity of the neck and upper trunk during lateral sleeping position in different pillow heights is still a gap in the literature. We already know that many people might not fall asleep when the neck is stiff and shoulder muscles not relaxed. In addition, we use props to relax the joints and loosen stiff muscles. Pillow temperature must also be taken into consideration. A pillow that helps reduce core and head temperatures during nighttime sleep has been shown to be important for deep sleep. The reason individuals using a pillow made of a material that helps the pillow surface stay cool could fall asleep more easily and sleep well is strongly related to the lowered core and head temperatures and slowed heart rate. Moreover, a pillow designed to reduce the temperature of the head can also reduce sweating and whole body temperatures and indirectly improve sleep quality. The traditional dimension of the pillow used in many countries is 50 × 70 centimeters, with a height of 10 to 18 centimeters. In order to make them soft and comfortable, they can be made in different materials, for example feathers, or polyester fiber, and latex and others, and in different formats, for example the traditional rectangular ones, format of triangular or ergonomic ones. The pillow should adjust to the different decompetence positions adopted during sleep. For instance, in the supine position, if the height of the pillow is too high, it will cause flexion of the neck. Similarly, if the height of the pillow is too low, there is hyperextension of the neck. Both can impair respiratory function during sleep, increase the muscle activity, and generate pain. The EMG activity of the neck and mid-upper back of asymmetric adults using foam pillows of different heights, 5, 10, and 14 centimeters, was evaluated. The 10 centimeter pillow foam elicited the lowest EMG activity of the mid-trap in the lateral decompetence as was considered by the participants as the most comfortable one. A study conducted with participants with high variation in height from 155 to 180 centimeters found the intermediate pillow height of 10 centimeters as ideal, as other investigations also have proposed. Indeed, the ideal height for each person is a fundamental aspect of pillow use. This is a product that needs to be designed specifically for a population according to their anthropometry. Final words. Material properties of sleep systems should be adjusted to personal needs in an objective way and preferences, for the reason that they are the underlying determinants of most physical ergonomic features, for example spine support. For example, obese patients need a firmer mattress in order to prevent the pelvic girdle from dropping too deep into the mattress. Materials, therefore, must be developed and combined to optimize general sleep system characteristics. That's all for today, for the sleep ergonomic topic. I'm Chris, a physiotherapy student.